Hi, this is an educational video regarding disseminated intravascular coagulation, also known as DIC, in pregnancy. We're going to do a patient assessment. It's going to be a fake patient though. We're not going to violate HIPAA today. Go over some vitals, diagnostics, and then we're going to go over some common orders you may see to try to treat this patient. Last but not least, we're going to do a reassessment on our patient. All right, let's meet our patient. She is a 38-year-old female, 40 weeks pregnant. This is her first baby, prima gravida. Let's give her an assessment. Upon assessment, I found out that she is tachycardic. Let's see, and also hypotensive. Let's check her IV side. Gave her some oxygen because she is a little pale and diaphoretic. Skin's a little cool to the touch. She is complaining of abdominal tenderness. She said 10 out of 10 pain, don't touch. She said, you're lucky I let you put these fetal monitors on because I hurt and my back hurts. A lot of pain. And let's see, I'm noticing some bleeding around the gum lines. Let's see, her IV, there's some blood coming out. It's a little bloody and I'm noticing some bruising. While I was asking my patient about her medical history, I noticed she sounded a little confused, so I gave her some orientation questions. She is ANO3 to location, so she is a little confused. She does have a family member in the room with her, and I'm on the phone with the doctor right now. My patient is showing signs and symptoms of shock, which needs to be addressed quickly. So I have our patient's lab results, and before we go over them, I think I'm going to go over the pathophysiology behind DIC. That'll help us understand our labs a little better. Now, when DIC occurs, it's that coagulation cascade that got initiated in our body. And in DIC, the coagulation cascade it's accelerated and it doesn't really stop until it's used up all the coagulation factors. Which is interesting because you can actually hemorrhage, essentially, because you don't have that clotting factor. It's been used up, the fibrin takes longer to form, and platelets are low. On to the lab results. Alright, here we have our patient's D-dimers. They're very elevated, definitely a positive result. And if you think about it, with our patient her body is making clots and they're being broken down, that number is going to be high. Let's see, her platelet count is low because they've been used up during the clotting process and they're being used up faster than her body can create new ones. Along with fibrinogen, that number is going to be low because it was used up to create fibrin for the clots. Let's see, her PT and PT times are prolonged just because it's taking longer for her body to clot, to catch up. In the beginning of a patient when a patient initially has DIC, the PTT time actually may be low, but as those clotting factors are used up, that number is going to get prolonged, that time. So the ultrasound tech was able to come in and do an ultrasound, and she did find a degree of placental abruption. And it does turn out that placental abruption is one of the main causes of DIC. In order to treat the DIC, we're going to have to treat the initial problem, which is the placental abruption. Now, in order to treat that, we're going to have to have the baby born. Usually it's a cesarean section. However, with DIC, when hemorrhage is such a problem that we really need to focus on. And the abruption was such a small fraction that the doctor has given the go-ahead for a vaginal delivery. So far, the baby is doing good, viable. Haven't noticed any decelerations, so that's good. So the doctor has ordered Pitocin and platelets. I've notified the blood transfusion team, so we have she's been typed and crossed, and we have red blood cells. On standby. Something I would like to note is that even if you don't know the cause for the DIC, it's important not to delay treatment for DIC. Hemorrhage is such a risk factor for this patient, so don't delay it. If the patient needs blood products, give them blood products, fluid resuscitation, platelets, start that going and then find the cause. Here is mom and baby. She did go into labor, like probably about 2 hours after my last update. And she did very good. She only lost about 400 mLs of blood. It could have been a lot worse. We had red blood cells on standby. She did very good with the platelets. Right now we're working on fluid resuscitation. And even the APGAR score on the baby was a little lower than I'd like, but we've been promoting skin to skin and oxygen therapy. And just trying to keep the baby warm. So, mom's vital signs. We're going to go ahead and reassess her. Okay. Let's see. We're going to check her blood pressure. And through fluid resuscitation, it's actually gone up quite a bit. I'm so much happier with these numbers. Let's see. And her pulse rate has gone down. It's within defined limits, along with respirations. Mom is still a little bit tired, but just did have a baby. But she's alert and oriented ×4, which is better. We no longer have that confusion. Apparently we did not clean up the blood. Thank you for watching my video on DIC. Have a wonderful day.
Have a wonderful day.